My name is Kari Nadeau. I'm a professor at the Chan School of Public Health here at Harvard. I'm very excited also to be the chair of environmental health and also a professor of medicine at Harvard Medical School. The area that I do research in focuses on wildfires and wildfire smoke because I myself also have lived in California where I had to evacuate my home 3 times. And that really affected me as a researcher to be inspired by all of the issues that people deal with for wildfire smoke. And I'll talk about those because wildfire smoke is unfortunately not wild anymore. Unfortunately, we're seeing more and more fires on the wildland-urban interface. And because of that, residential buildings are going up in smoke, commercial buildings are going up in smoke, cars are going up in smoke. So you can imagine that your favorite things under the sink, that fuel from cars, it's all going up in the air. Your detergents, other things that are in your home. And because of that, the smoke from wildfires tends to be about 10 times as toxic as typical air pollution. A lot of people have contributed to that knowledge. I've also been working on the importance of looking at health outcomes in the very beginning of getting exposed to a wildfire, as well as long-term issues that are associated with the environmental exposure to wildfires. First, even within the first 4 days of exposure to a wildfire, you can start having itchy throat, asthma attacks, stroke, heart attacks. Those increase by about 40% depending upon the age group that's affected. And the important thing about wildfire smoke is that even if you're hundreds of miles away from the source of the wildfire, the smoke can still be inhaled by an individual, and that can affect your health. Now, importantly, we also do a lot of work on, and you've heard from my colleagues, about solutions facing research with policy-oriented outcomes. And with that in mind, my laboratory, for example, studies the field of exposomics so that we can understand to what degree in someone's blood, if they've worn a mask or if they've used an air filter during a wildfire smoke exposure event and they haven't evacuated from their home, to what degree did that intervention, either the air filter or the mask, actually help reduce the health risks in their blood and in their own health. And so with that in mind, we're doing a lot of work on what solutions can we think about to test to see if we can help provide people with action-oriented items to be able to help manage issues that are associated with wildfire smoke. After the terrible events that happened in January in LA, we got 10 universities together, which is unprecedented to do within 2 weeks, and think about ways to support the community in real time, give data back within a week, and have the data be exactly addressing the community's questions. Because again, we want solutions, we want to help people manage this, we want to be able to do research and answer their questions with how bad is wildfire smoke? Is it going to affect my children? What do I have to worry about after my home is cleaned up? Do I have to worry about my children going back to school? All these things are important, and they aren't only questions that LA community asks, they're also questions that other communities ask that are unfortunately affected by wildfires and wildfire smoke. So we're really happy at the Harvard Chan School of Public Health. Our amazing Department of Environmental Health does research like this, as many other items that you're gonna hear about through these videos. I appreciate your time. We're always happy to talk and help public health officials, help scientists, and help the community and help the world at large work together to be able to find solutions for these extreme weather events like wildfires. Thank you.